Okay. And next route of drug administration is intramuscular route of drug administration. Here, intramuscular means the drug will be injected into the muscles. Which type of muscles? Especially large skeletal muscles like deltoid, bicep, gluteus maximus, and rectus femoris are the muscles where the drug will be injected. Okay, coming to the advantages or disadvantages of intramuscular route. Advantages is absorption is reasonably okay. And remember the last slide in the intravenous route. What I have said? I have said that absorption is not present only for intravenous route. Whereas here absorption is present, but it does not take more time, just more time like oral route of drug administration. If we if we assume that if oral dosage form require 10 minutes for absorption, if the same drug the dosage form is given by the intramuscular route, then it require less time. Okay, the absorption of the drug is administered by the intramuscular route is reasonably okay. Rapid onset of action is present. Mild and irritant drugs can be given through the intramuscular route of drug administration, and first pass metabolism is avoided, and gastric factors can be okay, that is gastric pH, gastric juices, these are also avoided with the intramuscular. And next one is disadvantages. Here the disadvantage of the intramuscular route is only limited quantity of drug can be administered. That is only up to 10 ml of drug can be given by the intramuscular. And another problem is local pain and abscess may happen. And next thing is it require assistance. Okay, all the parental route of drug administration require assistance, especially injections. And next one is the dosage forms for the intramuscular route of drug administration are expensive, and there's a chance of infection at the site of injection, and sterilization is required if the site of injection is not proper, and if it has caused any damage to the nerve, then there will be serious problems will be present if nerve damage happens. Next one is subcutaneous route. Drug is deposited in the loose subcutaneous tissue. The best example for the drug that is given by the subcutaneous route is insulin injection. Insulin injection is given by the subcutaneous route. And this tissue also is rich in nerves. This also has to be given carefully, and irritant drugs cannot be given by this route of drug administration, and the site is less vascular. Okay, because of less vascular in nature, the absorption of the drug will be slow. Okay, comparatively with the IM route, this subcutaneous route of drug administration absorption is less. Next one, in case of shock, if the patient is in shock, then this route of drug administration should not be given. Why? As first thing is this tissue, this site is less vascular. Now, because of shock, vasoconstriction will be there. Because of vasoconstriction, the absorption of the drug will be almost decreases. Okay, so in case of shock, this route should not be used. And another thing with the subcutaneous route is only small volumes of the drug can be injected, and subcutaneous injection minimizes the risk associated with the intravenous. vascular injection. This thromboembolism or these will not happen with the subcutaneous. And next one is depot preparations can be injected by the subcutaneous. That is, in depot preparation is a oily preparation where the drug will be given to the subcutaneous tissue. And dermogenous pellet implantation will also happen in the subcutaneous tissue, cellulosic and biodegradable implants. All these are the drug storing, a type of drug delivery systems where these pellets or implants will be having drugs, and either these pellets or implants will be degradable or this has to be removed after a certain time. Next one is intradermal injection, where the drugs will be injected into the dermal layers, skin layers, and especially vaccines are given through the intradermal route. Apart from vaccines, sensitivity test. Now, if we take penicillin, in few people, what is going to happen is if penicillin is given, it causes hypersensitivity reaction. So, whether to find out whether the penicillin is suitable for that particular patient or not, small doses of drug will be given, and this is called as sensitivity test. Okay, so in this sensitivity test also the drug will be given to the intradermal. The next one is intrathecal route of drug administration, where the drug is administered into the CSF, that is cerebrospinal fluid. And the example for the drugs that are administered through the intrathecal is amphotericin B, which is given in cases of cryptococcal meningitis. Okay, in cryptococcal meningitis, to cure this one, amphotericin B is given to the subcutaneous, to the intrathecal route into the cerebrospinal fluid. Next is transdermal patches or transdermal route of drug administration, where there is an adhesive patch will be attached on the skin. These are just like a band-aids where it will be loaded with the drug. Once we stick this bandage, if you see the image on the right side, if we stick this transdermal patch on the skin, whatever the drug that is loaded in this transdermal patch will slowly release the drug throughout the throughout the period. I mean, here the rate of absorption can be vary markedly depending on the physical characteristics of the drug and skin at the site of application. Okay, now this drug has got slow effect and prolonged duration of action. This route is most often used for sustained delivery of drugs, such as anti-anginal drugs like nitroglycerin. Nitroglycerin is a vasodilator where this nitroglycerin drug containing transdermal patch will be usually kept on the heart, where this nitroglycerin will be released in the systemic circulation slowly for a long time. That is why these drugs has got prolonged duration of action. The next example is anti-emetic drug, that is scopolamine, which will place behind the ears. Scopolamine transdermal patch will be placed behind the ear so that the scopolamine will be released continuously, and this scopolamine will inhibit the labyrinthine nucleus, thereby suppresses the motion sickness. And even nicotinic patches are also available, which are used in the nicotine addicted patients. And the site of application of these transdermal patches are upper arm, on the chest, on the abdomen, on the mastoid region. These are the sites where the transdermal patches will be kept. And with this route of drug administration, there will be no first pass metabolism. And absorption is increased by oily bases and occlusive dressing and rubbing. Okay. Next one is topical application. That is, the localized effect will be seen. Localized effect of the drug will be seen. This drug will not enter into the systemic circulation. It produces only local effect on the skin if it is given by percutaneous route, for allergy testing, or for topical local anesthesia administration. Next one is for mucous membrane of the respiratory tract. In case of asthma, uh, beta 2 agonist salbutamol will be given through the inhalational route, which is used in the treatment of asthma. Now, this inhalational route of drug administration is a atypical one because depending on the drug, in this case of asthma, salbutamol is given. Salbutamol only acts on the respiratory system. If drugs like N2, nitrous oxide, which is used as a general anesthetic, if that is given by inhalational route, it will spread throughout the body. Systemic and local effect are both are seen with the inhalational route of drug administration. And what factor will decide systemic and local is depending on the drug. Next one is eye drops, especially for conjunctivitis, and ear drops, which will produce only local effect in the ear. For example, otitis externa, and intranasal drops for decongestion. Okay, to relieve the congestion in the nose, intranasal drops are, and the inhalational advantages is mucous membrane of the respiratory system are the sites where absorption will occur. Rapid absorption will be seen because of large surface area, mainly provide local action. Minor systemic effect will be seen, and the low bioavailability of the drug. Bioavailability you will study in the absorption part of pharmacology. For here, you just remember that bioavailability is the rate and extent of drug absorption in the systemic circulation. Here, as inhalational route of drug administration has got a minor systemic absorption, that's why it has got low bioavailability. And this route has got less side effects and no first pass effect or no first pass metabolism. The dosage forms for the inhalational routes are aerosol and nebulizer. Disadvantage is only few drugs can be given by through inhalational. So these are the nebulizers and atomizers, meter dose inhalers, which help in the transport or absorption of drugs into the respiratory system. And next and last, no single method of drug administration is ideal for all drugs in all the circumstances. With this, we have completed the routes of drug administration. In the next class, we will start the pharmacokinetics.